is Kayla Collins, and today I will be discussing dissociative identity disorder, also known as DID. This disorder was formerly known as multiple personality disorder or split personality disorder. Individuals with this disorder are most commonly known for having alternate personalities, also known as alters. These personalities may have their own names, behaviors, memories, voices, ages, ethnicities, and they may even be animals. Some individuals with DID have thousands of alters. The symptoms of DID include high levels of identity confusion, feeling disconnected with their body, and derealization, which is the feeling that nothing around them is real. DID is typically the result of childhood sexual or physical abuse, but it can also result from other traumatic events, such as natural disasters. This disorder is a way for the brain to detach itself from the trauma that has been experienced. A modern media example of this disorder would be the film Split, where the main character Kevin had 23 distinct personalities. DID is very rare, and the disorder only affects between 0.01 to 1% of the population. The disorder is also more likely to affect women than to affect men. Symptoms usually present themselves between 5 to 10 years of age. However, it is commonly confused with other common childhood disorders such as attention deficit disorder, and because of this, DID usually isn't formally diagnosed until adulthood. Common misdiagnoses of DID include borderline personality disorder, schizophrenia, and bipolar disorder. Individuals with DID are diagnosed with 5 to 7 comorbid disorders on average, which is higher than any other mental illness. It is also highly comorbid with post-traumatic stress disorder. People with DID typically have significant problems in their daily life, such as at school, at work, and in relationships. Suicidal behavior is also very common among individuals with DID, with over 70% of people with DID having attempted suicide. A quote by Jane Hart, a woman with DID, states, "I think the hardest obstacle I have to overcome in my day-to-day life is constantly being pulled in different directions with every decision. It can be very chaotic for me. It's like having a committee inside of my head, letting me know how they would handle things if they were fronting or in control. In some ways, my biggest challenge is also one of my greatest strengths, the ability to see everything from multiple perspectives." Jeanne Ferry was the first documented case in 1584. However, due to the time period, it was labeled as demonic possession. Ferry had multiple alters, each with their own name, identity, and identifying features. These alters were audible inside of her head and could even take control of her body. Ferry's disorder resulted from childhood physical abuse and possibly sexual abuse. Ferry was called the most perfect case of DID by Birdville, a man who reissued a book about her life in 1886. Jeanne was a nun, and her alters included Mary Magdalene, as well as 7 demons who represented the 7 deadly sins. A demon named Horns seduced her with sweets at the age of 4, which is how she explained her disordered eating. A demon named Sanguinaire demanded pieces of her flesh, which is how she explained her self-harm. And a demon named Garga protected her from the pain of her beatings during childhood. However, he started to reenact these beatings by headbanging, suicide attempts, and cutting her throat. Jeanne Ferry stated that she was afraid of other people and only loved the demons. DID has a history of being mistaken as possession, and then it was viewed as hysteria. Hysteria was seen as dissociative in nature and could involve disturbances of memory, consciousness, identity, and bodily functions, which are all symptoms associated with dissociative identity disorder today. Treatments for DID include psychotherapy, which is the most helpful form of treatment. Psychotherapy focuses on identifying and working through past trauma, managing sudden behavioral changes, and merging separate identities into a single identity. Some healthcare providers may also recommend hypnotherapy in combination with psychotherapy. Hypnotherapy is a form of guided meditation that helps recover suppressed memories. There is no cure for DID, but some of these therapies may help reduce the symptoms. Some medications may help with the symptoms that come along with DID, such as anxiety and depression, but there is no medication specifically for DID. Jenny Haynes is a woman with 2,500 personalities. She was raped and tortured by her father as a young girl, and to cope with the horror, her brain created new personalities. The abuse was so extreme and persistent that she generated over 2,500 personalities. The first personality that Jenny generated was a 4-year-old girl named Symphony. Jenny would switch to Symphony whenever her father was abusing her. Jenny stated during an interview with 60 Minutes Australia that Symphony suffered every minute of her abuse, and when he was abusing her, he was really abusing Symphony. Symphony began creating other personalities herself to endure the abuse that Jenny had shifted onto her. Each one of these thousands of personalities had a particular role in containing an element of her abuse. Jenny stated that she did not realize that people were supposed to have only one personality. If you know someone with DID, try to be patient and understanding. According to Mind.org, an organization that advocates for understanding and respect of mental illnesses, if someone you care about experiences dissociation, they may not always know how to respond. Ask them what would help, but be aware that they may not know. And if they want to tell you about their experience, try to listen to them with acceptance. My references include an interview conducted by 60 Minutes Australia with Jenny Haynes, the Cleveland Clinic, Mind.org, the National Alliance on Mental Illness, DIDresearch.org, and the Journal of Psychohistory. To summarize, DID is a very rare mental health condition that affects a person by having multiple personalities that affect how they feel, think, and act. A mental health professional usually diagnoses DID while treating the patient for conditions like anxiety, depression, or other trauma-related disorders. Counseling is usually the main treatment for DID. The goal is to slowly integrate the multiple personalities together into one identity. And the treatments include therapy, hypnosis, and medications such as antidepressants.